We are changing libraries in Mexico.
We are changing public libraries in Cambodia.
We are changing libraries in Kenya.
We're changing libraries in Nepal.
We are changing libraries in Ghana. We are changing libraries in Serbia.
We are changing libraries in Macedonia.
We're changing libraries in Zambia.
We are changing libraries in Bosnia and Herzegovina.
We are changing libraries in Chile.
Kenya National Library Service has adopted a new approach to providing services to the communities out there, after realizing that most of the information we have been providing actually is very conventional and does not identify with the needs of the communities. So this is a major paradigm shift whereby the institution is trying to reposition itself and striving to identify the actual needs of communities in terms of information provision so that we can give timely, relevant and up-to-date information to these communities.
We choose this project because there is a lot of demand for healthcare information, and many healthcare workers want to come to the library and seek health information in the library. Our library project has provided computers, CDs with healthcare information, books and internet free of charge for members of the healthcare workers and also our library users. This innovative library project will impact on people by empowering them on how to lead a healthy lifestyle.
Looking at our work is so weighty, and with shortages in our health facilities, you find getting an opportunity maybe to access information is a little bit very difficult. So a time came when the Kenya National Library Services identified health workers to train in Kisumu, and I'm lucky I was one of them. And after training, we were taught on how to access information on internet. And that was an eye-opener to me. It was a gift to me. I was very happy. And I acquired skills that could help me access internet and to be direct on health information that I wish. Some information are free online and some information are not free online. So from that time I came with a lot of joy, advertising these services that were introduced in our library here, telling my colleagues who are in school to come, students to come.
Our greatest challenges has been providing adequate resources for the healthcare workers and the public users. We have also space challenges, and the number of computers we have provided are not adequate at the moment. It is the first time as a public library that we are working with the healthcare workers directly and impacting on their knowledge and skills.
Initially, we used to have quite a lot of problems in terms of accessing information. Ours, naturally, I can say it was a sort of a natural way of doing things that we inherited from time immemorial when the technology was not advanced. So in most occasions, we are so much used to using hard copies, paperwork, so much paperwork. And this paperwork at times becomes a little bit cumbersome in terms of us getting information, in terms of postages, that is trying to get the information on paper, sending it to the second person, to the relevant offices, that is the province and the national. So it was a little bit difficult for us. As you may have seen in our resource center, the information that we have there is very small and very scanty information that are being delivered from a division of there is a division concerned with health education and promotion in Nairobi, and this information at times are not current. There might be information that were published 6 months ago, such that when we are consuming the information, another policy might have changed, and things become a little bit conflicting.
Many of our health workers who have visited our libraries have identified themselves with the library, and now they are partners, and they have shared their joy and excitement of using these health resources, and we are glad, and we also share that joy with them.